Good evening and welcome to all Rutgers faculty, staff, students, alumni, and friends joining us this evening. My name is Dr. Kelly Moore and I will be moderating tonight's discussion. I serve as the director of the Center for Psychological Services at the Rutgers Graduate School of Applied and Professional Psychology, and I'm also a proud alumna of the school. This evening, it is our esteemed pleasure to bring together 5 influential and dynamic thought leaders to discuss the psychological impact of the COVID-19 pandemic on the nursing workforce, as well as demystify the stigma surrounding mental health for frontline workers. These are critical issues that are worthy of our attention and consideration, and the experts we have here with us today are helping to shape and inform this important conversation. Please join me in welcoming School of Nursing's leadership and faculty, Dr. Susan Salmon, Executive Vice Dean, Dr. Charlotte Thomas Hawkins, Associate Dean of Nursing Science, Dr. Amita Avadani, Specialty Director of the Postmaster's Doctor of Nursing Practice Executive Model Program and an acute care nurse practitioner. Also joining us tonight is Dr. Donna Gaffney, a School of Nursing alumna and licensed psychotherapist, and 2020 Rutgers Nursing graduate Lindsay Green. At the end of this discussion, we will also hear concluding remarks from School of Nursing Dean, Dr. Linda Flynn. To give you all a better sense of our event format for this evening, we are going to keep our discussion conversational to allow each of our panelists to weigh in and share their individual thoughts and experiences. We have some prepared questions for our panelists, and we also have questions that were sent in from our nursing students. We will try to get to as many questions as possible while also sharing important work the School of Nursing is implementing for our nurses and looking ahead as the School of Nursing seeks to advance the innovative change-making field of psychiatric mental health nursing. It's safe to say we have a robust conversation ahead of us. Let's jump right in. I'd like to start with Dr. Donna Gaffney. Donna, you are a psychotherapist and psych mental health clinical nurse specialist. What are you seeing in your own practice regarding the effects of the pandemic on frontline nurses?
Well, thank you so much, Kelly, and thank you to the organizers of this incredible panel. It's so very important. First, let me say, I'd like us to redefine the frontline. Because I think all nurses are frontline nurses now. In my practice, I've heard of the labor and delivery nurse who was taken off guard when she admitted a patient, and the patient's partner who did not have a COVID test or hid the results of the COVID test, and the next day she found out that she had to quarantine from her 2 little children and her family and be tested. Or the school nurse who I worked with, who has to take on contact tracing in addition to her day-to-day job in the schools, and became the healthcare information specialist for the entire school. Or for the nurse educator who has to help students understand the need for mental health. And I'm speaking to Dr. Salmon and of course the whole School of Nursing faculty, because I know how hard you're working on that. So I thought about how I would phrase, give the response to this question. And I usually, some of the things that I say is, what brings you here today, or where shall we begin? And so I'm going to actually give you some of the words that my nurse clients have told me. So where shall we begin, and what brings you here today? Everything. It hasn't stopped. I have no time to recoup. Regular patients so much sicker and dying nonstop. I can't do this. My usual coping is not working. There's no light at the end of the tunnel. Usually I can see an end to a 12-hour shift, get back up and do the same thing. It's just terrible. People are leaving. There's such uncertainty. I have to focus and learn. It was too much dealing with patients and families. One nurse told me she went to a COVID-19 Zoom support group for nurses. She joined the call. All she could do was cry throughout the call. And then she said she wasn't really ready to share her feelings. And of course, my comment is, when are we really ever ready to share our feelings? Another nurse told me she had low moods, mood swings, off and on decreased appetite. When she went to her primary care provider, who didn't screen for depression and minimized her concern with COVID-19 patients by saying, well, they don't all die. She had another situation where this therapist didn't show up at the hospital. Therapist was giving time, volunteering, and the therapist just never came because she felt unsafe herself. She only had, the other nurse on her shift only had 6 patients. I use only loosely. And she would have to, she had 8 patients. Halfway through the shift, they still didn't get someone to help her. And she questioned, am I being unfair? Am I being a baby? And the answer is no, you are not. I mean, questioning their ability to provide care. Another nurse said that she felt less support and had to float to other units quite a bit. And she had to keep up with all of her patients for the first month and a half. It was really tough. She had one patient who was about her mother's age, and she really had a hard time with that. And that, of course, is empathic distress fatigue. During the height of the pandemic, I slept a lot more. I had anxiety. I ate more. I felt frantic and hyper-focused to get everything done. Another nurse said, I felt useful during the pandemic, but in September, 6 months later, it really hit her that she was struggling and had a great deal of anxiety, saw a counselor. And one of the things that several people have told me that they had a history of anxiety and maybe had seen a counselor before, or a history of a lot of deaths in the family. Those situations put our providers, our nurses at much greater risk. Another nurse told me that her mother died of breast cancer when she was in high school, and she was reliving a lot of what she was dealing with. Interestingly, she had COVID herself in March of 2020, and she still hadn't regained her sense of smell. And one of her quote unquote friends said, wow, that's really ironic. You, the biggest foodie in the world, can't smell. And she talked about how difficult that was for the one thing that was so important to her. So those are, looking at previous losses, consequences of COVID-19, not being recognized as needing support and not being able to attend to those needs that they had. And again, knowing that we are dealing with all nurses, not just nurses in acute care settings.
I really appreciate you broadening what we say when we mean when we say frontline. I think that just the recognition of that is very validating, I'm sure, for so many people here today and those that they work alongside of. So thank you for redefining that for us and broadening that definition for us. And just along with all the things that you've been hearing, hearing things like it's constant, nonstop, it's really overwhelming. These professionals' ability to cope, right? And just the overwhelming no end at the light at the end of the tunnel, as you said. Do you find that nurses, perhaps more than other professionals, are reluctant to seek help in your experience?
Well, I think all healthcare providers are reluctant to seek help. It's been pounded into our heads that we're caring, we understand this, we know what happens, but when it's us, it's everything goes out the window. In the mental health field, psychotherapists for a very long time have addressed the issue of secondary traumatic stress, vicarious trauma, and have done a lot of work in that area to stave off those very difficult situations. We need to do that with nurses, because what nurses have talked about this past 18 months, there isn't a therapist in the world who could handle all of that information and be there and be that healing presence for those patients. And so I think that we have a lot of education to do to let people know that it's okay to ask for help. And many of the nurses actually said, we asked them, what one thing would you do differently? And they all say, I'd get help sooner. I'd get help sooner. And I would share it with my friends as well.
That's really important. Just the ability to hear someone else normalize that it's okay to ask for help is really powerful. And I know we'll talk more about that as our discussion continues. So thank you so much, Donna, for all of your words. Amita, I'd like to turn to you for a question about, your experience. You're a doctoral prepared acute nurse practitioner, acute care nurse practitioner, and you practice in the ICU throughout this pandemic. Can you describe a memorable situation that you experienced and how it made you feel?
Sure. Thank you for this question. And I have to say, without a doubt, there were so many memorable situations that have been etched in my memory through this whole pandemic. First, let me say that I'm proud to have been in the middle of it all as we teamed up to handle the physical and emotional turmoil that COVID-19 pandemic brought to all of us. Well, as far as me, having all these years of experience that I did in acute care, I thought I had the knowledge, the skills, the experiential wisdom to handle the difficult situations that came my way. Not. The loss of life, particularly young lives that I witnessed during this time was unimaginable and something no amount of education could prepare us for. It wasn't just that we were losing so many lives or we were seeing so much suffering, but it was also how fast we were losing those lives, the fast pace of it. And I think Donna kind of alluded to that a little bit. So as the problem was, there was no time to reflect in between and to console yourself. And as we say, get up and run again. The lack of resources due to lack of evidence, because the evidence was still in the making. This was such a novelty. So all these things put together, the best way I can describe this situation is a war zone. And that's exactly what it was. So out of the countless heartbreaking stories that I could remember, one particularly affected me, and I'll share that with you. This has touched me so deeply, and that I do not believe I'll be ever able to overcome this. In fact, I recall this as my breaking point as far as being able to answer questions that are posed by family members in difficult situations. So I had a young gentleman who was really sick. And as the families could not visit, as we all know, because of the safety concerns, when this patient was not doing good, I would call his wife and speak to her. And even knowing that she could not come, we both knew she could not come to visit. She would always ask, can I come and visit my husband? And so one day when her husband really deteriorated, I did not think he was going to make it. So I called his wife and I told her to say her final goodbye, as I did not think her husband was going to make it anymore. She said, no, how could that happen? I have a 1-year-old baby and she needs her father. For the first time in my career, I was speechless. She continued, as I choked, let me show him his daughter and this would never happen, she said. We resorted to FaceTime after that so she could see her husband. And when she saw her husband and saw him connected to so many machines that she could not even recognize him herself, she cried. And unfortunately, her young husband and the father of this 1-year-old baby passed away moments later. I do not believe I'll ever be able to get over this situation. So that's really what jumps at me when I think about this. Thank you.
Thank you so much for sharing that story, and thank you for all that you and your colleagues have done and are still doing for all of us. So I just want to thank you for that. And I know that your story, like you said, so many of your colleagues share those experiences. Lindsay, if you could jump in as well. As a recent alumna, having joined the front lines as a critical care nurse when the pandemic was at its worst, can you talk a little bit about what you encountered?
Sure. Thank you for the question. I had little expectations. I was new to the field, and so all I could really use to gauge the situation was what I saw in the media. So entering onto the unit, a lot of what I saw was a lot of pain from the isolation that the patients and the family members couldn't couldn't connect with their loved ones at sometimes the last moments of their lives. And then also my colleagues having to endure quite a long stretch. It was like a marathon of trying to really connect with the patients, even through the different PPE, and just trying to have, say, therapeutic communication and therapeutic touch, all of those things that are emphasized to us during our schooling. And it was challenging to keep going and really to try to do your best to help them with the FaceTiming, and also to ease our own anxieties with having to be hypervigilant at times because you wouldn't know the unpredictable states of some of the patients, where you'd have some people come in who you would have all the confidence that, oh, they're strong, they'll recover, they'll be okay. And then next thing you know, they're the ones that are breaking your heart really with seeing the situation. So I saw a lot of anxiety and fear, and I held a lot of hands and shed tears myself, but tried to really know that I was doing my best and putting my best foot forward through it all.
Thank you for sharing that. And that kind of speaks to that teamwork approach and sort of having the support of your peers, and how important that sounds like it is and was for you as you were entering the field as a new nurse during a time where there really was no roadmap, right? And as was stated before, you know, as the evidence is coming in, you're kind of laying that pavement as you go along this road that has not been traversed. And so that teamwork element seems to be really important as well in terms of just being able to cope in the moment. Because as you said, it just kept going.
Absolutely.
Charlotte, how has COVID-19 over the last 18 months impacted our nurses of color? Oh, you're muted, Charlotte.
I was hoping I wouldn't do that. What I had say, Kelly, was that I think my answer is grounded in a survey that we conducted, and I'll share some key findings from that survey. But I'll begin with a context that informed our survey. There are two concurrent crises that many nurses of color have experienced during the COVID pandemic. One is the pandemic itself, and what we've heard has described a crisis and a war zone that nurses have experienced. And certainly this COVID pandemic has illuminated the persistent racial disparity in health in the United States population, in that COVID has affected persons of color at disproportionate rates. In addition, healthcare workers have also been disproportionately affected by COVID. Nearly 1/2 of all confirmed COVID cases, hospitalizations, and deaths among healthcare workers have occurred among healthcare workers of color. So in a pandemic where minority patients and minority healthcare workers are among the hardest hit, it's certainly intuitive that nurses of color who may feel especially vulnerable to getting sick from COVID and taking it home to vulnerable family members are experiencing high levels of stress as they balance workplace COVID exposure with ensuring safety for themselves and their families. Second, the COVID pandemic emerged amid heightened global attention on racism within and outside the workplace after the murder of George Floyd. The worldwide protests that occurred in response to this event brought the issue of persistent racial injustice and biases against persons of color into the limelight. And so we know that nurses are no exception to experiences of workplace racial injustices and biases. The experience of persistent and pervasive racism and discrimination in the workplace is the second crisis that is not new, but one also experienced by many nurses, especially nurses of color, amid the COVID pandemic. So these two concurrent crises informed a survey that our research team conducted to understand the level of emotional distress among frontline nurses in hospitals who were experiencing high levels of worry about COVID for themselves and their families, and also experiencing workplace racism. So we distributed a survey statewide to nurses working in New Jersey hospitals in November 2020, and that was during a time when New Jersey had one of the highest rates of COVID in the country. And our sample included nearly 800 hospital-based nurses of all races across the state. 80% of nurses reported that they cared for COVID patients, and nearly 50% of the nurses in the sample reported that they cared for COVID patients who died. So we asked nurses about their emotional distress, the extent to which they were worried about COVID and worried about getting sick from it, their perceptions of the racial climate in their workplace, and the types and number of workplace microaggressions they experienced in the past 6 months. And overall, nurses reported a high level of emotional distress. It's similar to the emotional distress that Donna spoke about that nurses reported to her. 70% of nurses in our sample reported burnout. That's 3 out of every 4 nurses in our sample said that they were burned out. 57% reported anxiety, and nearly half had severe levels of distress. There were also significant racial differences in the level of emotional distress, COVID worry, and workplace racism experienced by the nurses. Compared to white nurses, nurses of color reported higher levels of emotional distress, higher levels of worry about COVID, more negative racial climates in their workplace, and a higher number of racial microaggression types that they experience. And Black nurses reported the highest number of microaggression experiences and the most negative racial climates. A high level of COVID worry was significantly associated with a high level of emotional distress. And similarly, multiple types of racial microaggression experiences and negative racial climates were also significantly associated with high levels of emotional distress. Importantly, we also found that it was the combined experiences of workplace racism and COVID worry that represented a dual pandemic for nurses, largely nurses of color in our sample. The level of emotional distress was amplified to severe levels in nurses who experienced both high levels of COVID worry and negative racial climates, or who experienced high levels of COVID worry and multiple workplace microaggression experiences. So an important lesson that we learned from our survey is that workplace racism is a reality for hospital-based nurses, especially for nurses of color, and that the psychological impact of racial trauma experienced by nurses of color during the COVID pandemic can't be overlooked as we implement strategies to address distress that frontline nurses in hospitals are currently experiencing.
Thank you so much, Charlotte, for just describing so clearly all of the findings from your research. And as you were talking, as a psychologist, I was just like, so many things were clicking for me, because the burnout, and as was talked about, that secondary traumatic stress, and then the multiple layers for nurses of color, for Black nurses that responded to this survey, who were already experiencing racial trauma as a result of just racism in our country and systemic racism that already has existed, continues to exist on top of the pandemic. And I have to say, I was struck by, those numbers around 70% of the burnout, and that half of those that, suffered the most from COVID that are healthcare workers, are, healthcare workers of color. It's very alarming data that you shared, but very important, I think, for us in this conversation. So thank you so much for laying that out for us. Sue, I want to bring you in and just ask, as you've been working diligently with our nursing students and nurses in the field here in New Jersey, Can you speak to how they have felt during this time?
Yes, thank you very much, Kelly. During COVID and continuing today, I have been leading virtual Schwartz Rounds as part of a Robert Wood Johnson grant called the New Jersey Nursing Initiative. Schwartz Rounds are a guided discussion where nurses are able to talk about the human interaction, the human dimension of their caring. It's facilitated by mental health experts. Donna is one of them, as are several of our faculty here at Rutgers. And the purpose of this rounds is for nurses to share their emotional experiences, to share how they are doing, to receive support. And for many of these nurses, it's the first time they've ever communicated about what they went through. So I'm going to take that data from the last 18 months and summarize how we see from these Schwartz Rounds nurses are doing. I want to separate it into two waves though, because really we have waves of this pandemic. What we call that first wave, then a lull, the second wave, then another lull, and we're back in, a third wave. So looking at the first wave, beginning in March of 2020, COVID hit and it hit hard. During this time, there was truly a roller coaster of emotions that were dominated by fear, terror, and anxiety. Every patient was on quarantine. There were limited PPE supplies. There was uncertainty, as Amita said, about the best way to treat patients that were rapidly crashing. Staff members were on edge, scared, and emotional. The fear of bringing the virus home to loved ones had some nurses isolating in hotels and not returning to their family. For other nurses, they found routines where they could derobe, get to the shower, and then join their family. But throughout all of this, summarized by one nurse that I think was very poignant, is that her nursing career had turned from a career where she was safe and comfortable to a terrifying career. As I mentioned, this was a time of tremendous uncertainty. The regs and the protocols on how to care for patients was changing daily. Many nurses were deployed from their routine units to work in ICUs and COVID units. They were out of their comfort zone. Nurses voiced fear and uncertainty that left them feeling stressed, anxious, and at times very powerless. Yet they also verbalized that this is what they did as nurses. They cared, they supported, they responded in times of need. For many, there was a renewed commitment to patients as the critical need for nursing during this pandemic was so evident. In the first few months of the pandemic, amidst this fear and anxiety was a laser-focused purpose of caring for the patients and their families who were not allowed to be with their loved one. In this short period of time, nurses witnessed more death than most of us have seen in our entire career. Nurses became the vital link between patients and families. Instead of face-to-face, it was now through telecommunications. Nurses kept families informed. They had the emotional struggle of providing information without taking away all hope. And for those that did not make it, in the final moments, nurses were the conduit for caring and goodbyes, witnesses not only to death, loss, and grief, but to conversations of love, forgiveness, and faith. Nurses promised families and patients that they would not be alone. They were witness to the fear and loneliness and remained to hold a dying patient's hand, prayed with them, and tried to soften the fear. This was nursing's true gift of compassion and care. However, being witness to this collective trauma and loss left emotional injury. Nurses cried in stairwells and break rooms. They cried on their way to work, and they cried on their way home from work. And within it all, nurses came together to support each other through the crisis of the pandemic. Nurses believed and stated repetitively that friends and sometimes family could never understand what they had seen, heard, and felt. But other nurses had gone through the same thing, and they were a stronghold of support for each other. Learning to cope with the stress, fear, and grief, they developed rituals to remain resilient. They interjected pause moments for decompression. After someone died, they paused and either individually or as a group remembered the person who had passed. Others formed support circles and prayer circles, held each other's hands, prayed for the person who had passed, their family, and for each other. This coming together brought a powerful spiritual connection that allowed many of the nurses to keep going. And for others, they developed small wins rituals. And that was that the nurses recorded the small wins. And then they would huddle every day and they would talk about the small wins so that hope and energy was part of their day. And ongoing resilience continued to be bolstered by the team camaraderie. Many nurses referred to their team as their family, and the family looked out for each other. One such group that was considered at risk and was mentored and supported were new nurses. We always talk about reality shock, but new nurses such as Lindsay entered nursing in a time that shocked everyone, let alone shocking a new graduate. And that mentorship and the support is something that hopefully will keep our new nurses part of our own ongoing work phase. The second phase started with a lull and followed by an upsurge, but it was in this lull that nurses began to recognize the emotional distress. That beginning surge, there was such adrenaline and there was such a attention to detail and having to get it done. It was during the lull that nurses began to recognize how they felt and that they needed resources. But many voiced that it was a foreign concept to have to reach out for help. They are the caretakers, and now they were the ones that needed help. They were used to being the strong, and they viewed it as a weakness to need support. And I think that that's something that we have got to overcome and recognize that if we're not all strong, that we can't be the caregivers that we want to be. And the need to destigmatize, the need for mental health services has certainly emerged from all of this.
Thank you so much. And as you are those that are listening in today and on the call, please feel free to put your questions in the chat. We are going to have some time to answer some of your questions, so please feel free to do that. Lindsay, before we move to talking about programs that the School of Nursing will be offering and are already offering, I wanted to just ask you, what have you noticed among your colleagues as they navigate these challenging times? Are they taking the time to seek mental health care? You're muted, Lindsay.
Darn, thank you. I think as we have come down from the larger surges that we have this time to process and that people are more willing to open up and seek help. But I find that a lot of times now we have during our shifts that we lean on each other and discuss things and process things together. And that has been helpful. But I do think there is a need for more mental health services to be put out there and more easily accessible to nurses and people who need it.
Thank you. So we'll actually kind of move into that part of the discussion. So in terms of the problem that we seem to have in front of us, right, is that throughout this pandemic, nurses have been kind of in go mode and doing what needs to be done. But along the way, obviously dealing with a number of mental health related issues that are often associated with trauma and traumatic stress. It's the lack of predictability, the anxiety, the stress, the constant change. Human beings really do thrive in spaces where things are fairly predictable and safe. And so obviously the pandemic robbed all of us of that, but even more so to those that were in the position to provide those constructs for us, right? And so it seems clear that some of the things that you talked about, Sue, in terms of the way that nurses really started to build on their resilience is kind of a great segue into some of the questions as we move into this segment here around current programs that are being offered through the School of Nursing or that are available to nurses. So Donna, I'll circle back to you. Can you share some suggestions for nurses and healthcare workers dealing with the post-traumatic stress that the pandemic has caused?
Sorry. Thank you so much to the other presenters. It's really so important to put a face on everything that the nursing profession has been experiencing. Some of the strategies and the programs that I've recommended, certainly the Schwartz Rounds. I can't speak highly enough of Schwartz Rounds. It's just extraordinary. But I have a couple of sort of go-to comments that I give to all of my nurse clients and to nurses, my nurse colleagues. And as you can hear, it's building on everything you've heard. Talk to each other. You are not alone. Recognize that you can heal. You are not alone. And sharing those resources, the healing resources, is so, so very important. Schwartz Rounds, the Emotional PPE Project, all of these and I think that there are a number of programs right in New Jersey where people can get, nurses can get, and health providers can get, a limited number of services. But I think that one of the educational parts of going through this process is that nurses now realize that that maybe there were some things that they could have been doing, should have been doing earlier that relate to their own lives, their own, losses that they've had early on in their lives. No one is exempt from that. All the work that was done in the area of compassion fatigue and vicarious trauma started really as a result of the Vietnam War, and that the soldiers brought their issues to the psychiatrist and said, you have to help us deal with this. And the psychiatrists were unprepared. They didn't know what to do. And that's how it all came about. So nurses are not exempt from that. This what nurses have seen this year and will continue to see in the future as things become more high tech is so much more difficult to deal with. I'm not sure I would, I think Dr. Salmon said, gone from a profession that was safe and to one that terrorizes. I'm not sure that we'll ever see that quote unquote safety again, or if it was ever there to begin with. I also tell my clients and nurse colleagues to practice self-compassion, And I have a reference for that I think is going to be posted. Kristen Neff has done the yeoman's job in terms of the research in this area. And she talks about the myths of self-compassion, but she's also published a new book called Fierce Self-Compassion, which is exactly what we've seen nurses doing this year. They draw the line in the sand and they say, unacceptable, I'm not going to do this. This is harmful to my patient. And they have ideas, just as you heard Dr. Salmon say, they have incredibly creative ideas. We need to listen to them. Hospitals need to listen to them. The second handout that I like my clients to read is Everyone Needs a Therapist. And it's 3 reasons why everyone needs a therapist. And the last thing is that, which I've really dealt with quite a bit and heard nurses share these incredible stories. We must reorient and relocate stress to address it in a more complete way. It is not only about the individual. Mental health does not exist simply on our brains but in our bodies, our communities, and our contexts. And until we begin to look at that, we can't afford to have the nurses take on this burden by themselves. You know, the founder of the Lorna Breen Foundation said so eloquently, during the pandemic, healthcare professionals are the canaries in the coal mine, the healthcare system. Nurses who have endured more than any other professional during the pandemic are the siblings to all of those other canaries, the doctors, the respiratory therapists. And so what is happening is they are attempting to shore up a hospital system, a healthcare system that is problematic. The answer is not to create stronger canaries, although that's a good start. The answer is to redesign the coal mine, the hospital system.
Donna, there's a question in the chat, and as you were talking, I think you kind of started to answer it, and I'll add to that before I move to Charlotte and ask some more questions. But Susan Higgins says, I agree that nurses should be supported in seeking mental health resources, but how can leaders best help staff who are suffering and showing signs of PTSD and compassion fatigue? And I think this speaks to what you're saying about almost like the idea of creating a trauma-informed environment where it's understood in the workforce and in environments where, our frontline nurses are working, that this is a potential, occupational hazard, if you will, and that it's critical to create environments where from the time they come into the field, so the educational element, but as well as in the actual, workspaces, that there is opportunity to talk about it and not feel shamed by it. And really changing the culture around what it means to share when you are feeling overwhelmed or when you need a break. And I think, some of the things that you all have been talking about really speak to how nurses really did that, by default because they had to. But how do you keep that momentum going as we continue to be in this world post-COVID, because that's not going anywhere. And so I think leaders can really help their staff by creating environments from the door that this is what you're allowed to talk about this here. You're allowed to ask for help, and I'm going to listen to you, and I'm going to make sure that who I hire is going to endorse that same, belief system and really embed that into the work that we do. So thank you so much, Donna, for all that you just shared that you use in your practice. And Charlotte, I'll ask you, you've discussed the effects of racism and microaggressions on nurses of color. What programs or interventions do you envision that might address this very important problem?
My beginning thoughts as I listened to many of the panelists, and we're talking about kind of nurses, mental health in the context of COVID. And COVID is a pandemic, it's a crisis. And as we thought about the survey that we did, there are two crises, but one is not a new crisis. It's been here, and we are praying that COVID goes away or it gets at the level that we learn to live with it. So those public health crises come and go, and we respond to it. And I am sure that nurses' mental health, there are going to be long-term psychological effects from the COVID pandemic. But the COVID pandemic will become a thing of the past. What will persist and hasn't gone away, and I don't foresee it will go away in the near future, is racism. And so we have employees in all workplaces who experience racism in their personal life and racism in the workplace. And so I guess my ideas about what strategies really focus on strategies targeted in workplace organizations, but underscoring the notion that probably racial trauma, as people begin to feel more comfortable, talking about the stigma of psychological impacts, but also talking about their racialized experience, that racial trauma may emerge as a chief complaint among healthcare practitioners. And it underscores the importance, I think, of acknowledging and addressing the invisible wounds that employees, especially employees of color, have in the workplace. And so there needs to be within a workplace organization multi-level strategies to address and mitigate racism that are targeted at the interpersonal level as well as the organizational level to provide equitable, inclusive, and safe work environments that cultivate positive well-being among all nurses, especially nurses of color. So that, and I know that Sue is going to talk about some strategies. Donna has talked about these strategies that are targeted to individual employees within a workplace organization to manage racism, are becoming routine, especially because of COVID within organizations, such as implicit bias training, that aid individuals in recognizing their own biases and hopefully learning how to manage them. And there is research support that demonstrates that these types of strategies have positive individual level impact, meaning that attitudes and individuals' attitude may change at the individual level. But despite the current popularity of these approaches, within a workplace organization, these individual impacts may be short-lived if institutional level policies and practices don't change. And so assessments and reviews of organizational policies and practices that may foster racial bias and favor some employees over others, I think should be conducted. And based on these organizational assessments, concrete goals, action plans, strategies, and evaluation metrics for improved practices and policies that foster racial equity and inclusiveness across a range of organizational functions should be developed and implemented to facilitate a meaningful and more lasting change in the workplace racial climate, and also in reducing interpersonal racial microaggressions. We also need to create safe and trusting workplace environments where nurses and other employees feel free to share their racial trauma. We need to train managers and supervisors and organizational leaders so that they have the skills and the time to listen effectively to employee trauma histories. And if that's not possible, bring in expert consultants that have the expertise to deal with these safe space dialogues. And lastly, we need to offer concrete support, counseling, support groups, and self-care management strategies to maximize employee resilience and well-being in the workplace.
Thank you so much for that, Charlotte. Amita, I wanted to ask, as you continue your work in acute care, can you share where you have been able to find moments of resilience and hope?
Sure. So for me, the resilience really comes from my own self-care routine. And I think that this has been also emphasized by others. Anybody, whatever your self-care routine is, for me, it's exercise and some meditation that helps me. Also feeling of community with the colleagues, being able to speak to others who are experiencing the same thing. As far as having hope, I think the vaccine has added hope, advanced treatments that have added some hope. But I think it's really important to also recognize for all of us, and I know this has been also addressed, that coping mechanisms work to a certain extent, and we all need to learn to recognize at what point we need to seek expert help for our mental health support. I also think that it'll take us a long time to recover from the emotional impact of COVID. And as we all know, it's not even close to over yet. It's still going on. So I think in addition to the effect of the pandemic, we have burnout, the shortage of nurses, which has already been emphasized as well. I really think that having support for the nursing workforce, which is feasible, and that's the last point I'll make, and I'll use an example here, because I think everybody talks about creating supportive work environments, and okay, let's create a resilience room, but do we make that resilience room feasible for people? if you're stretched so thin and you do not even have time to eat lunch, are you going to have time to go to the resilience room? And I think that's really important for all of us. And I'll end there.
So important, making things accessible, that's really critical. Lindsay, you bravely joined the nursing workforce during an unprecedented time. What advice would you share with current nursing students and new nurses joining the profession?
I would just echo what Amita was saying as far as self-care. I think trying to think of what kind of self-care routines work for you, what kind of support systems you can have in place, and try to start exercising those before you begin. So it just feels natural to fall into place. And lean on your loved ones. I think that's crucial, and seek mental health support even before starting nursing. I think it's important.
Thank you. Definitely echoing Donna's sentiment there. Having it be a part of your lifestyle already, it definitely makes it easier when you really, truly are having a tough time. So Sue, before I turn it over to Dean Flynn, I'll end with you and this question, pretty big question, but wanted to ask, what have you and the School of Nursing put in place to address the mental wellness needs of nursing students and frontline nurses? Specifically, how the School of Nursing is addressing the stresses and the mental strain that we've been talking about related to the pandemic throughout the academic year, and what new programs may be in development that you can tell us about.
So I've already mentioned the Schwartz Rounds, and that's something we're going to continue to do and to expand. One of the populations we're going to expand it to are student nurses. When you think of student nurses, some of those are graduate students who were frontline caregivers during the pandemic. Some of them are undergraduate students who worked in many of these facilities and experienced the same trauma without the same understanding, perhaps, that experienced nurses had. So our goal, starting in October, is to bring Schwartz Rounds to students and have some of the same guided discussions as to how they are coping and how do they maintain resilience. We certainly saw in our student body the impact of COVID. There was a different, it was a different environment. It was, we had to be flexible in terms of what students needed and what students could accomplish. And we need to learn from listening to the students as they continue to go through this. So Schwartz Rounds will be coming to the students. Another program that we've put into place, and we've now put it into place in 38 healthcare facilities or academic institutions. And that is, we've trained individuals to implement stress first aid in their workplace. And when Susan asked, how can we help staff who are suffering and showing stress injury, stress first aid is not only an individual coping strategy, it is an organizational strategy to help individuals and teams recognize stress injury, respond early to stress injury, and there's a whole program of how to recognize it and interventions that can be taken. It is, the beauty of the program is that it's very simple. It uses colors, a green light, we're in the go zone, a yellow, an orange, and a red. So we're used to that, and organizations have started incorporating nurses coming in on a daily basis and putting discs on a magnet chart and showing that they might have started off in yellow and now they're in orange, and leaders know to respond. This is a unit that is in trouble and they need to respond. So it's staff taking hold of it, it's leaders taking hold of it. We have incorporated that into our entering nursing students curriculum, in that we present stress first aid. We talk about the importance of that peer support and coming forward for support. And I think as academic organizations, we really need to do a lot to really build that culture of wellness, which really hasn't been a priority within nursing programs. And lastly, we hope to, we are starting what we call NJ New, which is going to be an institute looking at the emotional well-being of nurses. It will have both a research and a service arm, so that we continue the work of what we've been doing. Rutgers is taking a lead in the new Academy of Nursing report on looking at nurses' role in achieving health equity. And Rutgers is taking a role in leading the rollout in New Jersey. Certainly the one of the chapters and recommendations is on emotional well-being in nursing, and we will be continuing that initiative within our institute.
Thank you so much. And just, I'm so inspired by everything you all have shared, and just know that your colleagues in psychology are also here to help in any way we can. I know at GAZAP, we have a specialty clinic that's really focusing on health psychology. We just created a health psychology specialization for our doctoral students. So we're partnering with a number of medical providers, and that integrated care piece is very powerful, I think, in sort of crossing over lanes and being there to support our colleagues in various health professions. And so it's really been an honor to be here to moderate the discussion. And I'd like to end by turning it over to Dean Flynn for some final remarks. Thank you so much for having me.
Thank you so much. And thank you, panelists, for this very informative and very important discussion. From everything that we've said and heard during the past hour, it is abundantly clear that the pandemic has had a significant negative impact on the mental well-being and emotional well-being of our nurses. So to the nurses in our audience, let me reiterate, if you are suffering from depression, if you are suffering from anxiety, PTSD, burnout, or any other major threat to your emotional and mental well-being, please reach out and know that you are not alone. Please reach out to counselors and professionals who can help you begin and end your journey towards healing. On the screen, you'll see just a few of the many resources that are available to you, and we'll have others posted on our website. So please, please take care of yourself with the same determination and the same diligence with which you took care and you continue to take care of your patients. It's also very clear from our discussion that Rutgers School of Nursing, our graduates, our faculty are involved in many activities to bolster the well-being and the emotional well-being of the nursing workforce. But we can do more. We should do more. So I'm very excited to announce to you today that our vision is to create the Hildegard Peplau Endowed Chair in Psych Mental Health Nursing. Now, for those of you who do not know who Hildegard Peplau was, let me explain. She was a doctorally prepared nurse and a psychotherapist. She was the founder of the specialty of psych mental health nursing in the United States and in the world. She created the very first graduate program to prepare psych mental health nurses to provide the support and the counseling that our residents, that our friends and our family members need. She did this in New Jersey. Specifically, she initiated the very first educational program to prepare these advanced practice nurses at Rutgers School of Nursing, where she was faculty many years ago. So in creating this endowed chair in her name, we not only honor her innovation and her memory and her contribution, but we will also leverage those endowed funds to create scholarships for students who want to become psych mental health advanced practice nurses. The IOM, or the National Academy of Medicine, which it is now called, recently published a report that specifically said that we desperately need more psych mental health advanced practice nurses in our nation. And I know that we desperately need them in New Jersey. With this enhancement of our programs, we can extend and expand our services. We can outreach not only to the nursing workforce, but also across the region to our friends, our neighbors, and our community. So if this vision resonates with you, please reach out to us. Talk to Alicia Bowden, who is our development officer, and she'll be happy to provide you with some more details. So again, many thanks to our panelists for this very important discussion. Thank you, Dr. Moore, for leading this discussion. Thank you for your insights and your very thoughtful questions. To our frontline nurses, let me say a special thank you. Thank you for caring for us, our family members, our neighbors, our friends throughout this tragic pandemic. We owe you a debt of gratitude that we can never repay. And to our audience, thanks for being with us today. I hope that you found this discussion insightful and that you found it important and that you learned something about what we're experiencing and what we're trying to do. Thank you so much.